Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, and today we're going to talk about the Surprise Medical Billing Act. What is a Surprise Medical Billing Act? Who are the winners? Who are the losers? And who are the players in the game? So let us focus on the feature presentation. I'm going to start off with a simple illustrative example and try to explain this Surprise Medical Billing Act and how it affects patients, doctors, insurance companies, and the public. Let us say, for example, a patient comes to the emergency room with broken bones. This patient is seen by the doctor in the emergency room and treated in the hospital, and he sends a bill for $3,000. So, this is a hypothetical situation. The innocent patient is unaware of the fact that he is seeing a doctor out of network because this was through the emergency room. He had no idea. He was not even able to communicate. Anyway, so the doctors send a bill to the insurance company, his HMO, as an out of network doctor. However, the HMO says that, well, our network max is $2,000. We pay 70% of that for out of network doctors, so we're going to be paying $1,400. And before this Surprise Medical Billing Act came into effect in 2022, the doctors could bill for the remaining balance of $1,600. That may not seem like a big amount, but there was a case that was reported on PBS where a lady with a COVID was in a state of unconsciousness, was intubated, transferred from one hospital to the other, and both these hospitals were in the network, except the ambulance was not in the network. And the ambulance cost was $52,000. And since this happened before the bill went into effect, the patient had no choice but to either pay the bill or negotiate with the ambulance company. However, the Surprise Medical Billing Act has answered many questions. It has left a few questions which are really not answered, and we're going to focus on each one of those. So what is going to happen here? A doctor who billed what he thinks is reasonable charges for multiple fractures, $3,000, he was getting only $1,400, half of what he would normally bill. And who is going to pay this $1,600? Obviously, the patient may not have the money to pay for that. Then who is responsible? So the Congress came up with this Consolidated Appropriations Act 2021, in which the Congress set a series of rules for the patients, for the insurance companies, and for the doctors, and how to resolve this issue without having the patients caught in the middle. So let me say that. Let me go back here and say the Congress came up with this consolidated bill. It said, okay, things happen. You are going to be out of network. 1 out of 5 situations, patients are out of network when they need medical help. Having an emergency, and they didn't know the doctor was not on the program. Any number of things can happen. But anyway, let's get back to this issue here. The Consolidated Appropriations Act has laid down certain ground rules, and we're going to look at those things. Okay, first thing, as far as patient protection etched into law, that is, the doctors cannot bill the patient more than what the insurance company approves as out of network copay. So in our example, the insurance company said, well, we approve $2,000, and since you're out of network, we only pay 70%. That means we pay $1,400. You're responsible for $600. But there's a difference between $600 and $1,600. And the doctor says, well, it was not my choice. All right? You needed treatment. You came through the emergency room. I have given my emergency services, and this is what my charges are, and somebody has to pay this $1,000 difference. And that's where this Consolidated Act comes into play. The Surprise Medical Billing Act says the patient cannot be billed for the balance of that $1,000 in our example, our hypothetical example. So who is going to pay for that? To order that question, the provision also provided some fair compensation mechanism for physicians. First of all, the insurance company has to send a letter of denial within 30 days after filing a claim. That gives doctors, it used to give 2 days to dispute that bill, but now that has been increased to 4 days, as you can see here. The doctors and the insurance companies can sit down with an arbitrator and arrive at a reasonable amount. What is a reasonable amount? I'm going to cover that part in a I'm going to cover that in a minute. And in this way, the surprise billing going to the patient is totally eliminated. The patient is only responsible for the out-of-network copay, and the patient pays the doctor and they are done. Now, the negotiations are between the doctors, HMO or PPO, and now we have a third party introduced here, the arbitrator. Of course, the arbitrator is supposed to be fair to both parties because the doctor rendered the services and the HMO has an obligation to pay for it because they told the patient they're going to cover all services for what the patient needs. So here are some of the things that concerning non-emergency situations. In a non-emergency situation, if a provider submits a bill to a patient in excess of what the network approves, then the doctor is supposed to return that money along with interest. So doctors, are you listening? My friends, my colleagues, if you are sending a bill to your patient who is not an emergency case, you've seen this patient in the office and you agreed to do the surgery, everything has been cleared, but now you send a big bill to the patient. But you cannot. If you do and you collect the money, you have to return it with interest. There are situations where the data are not up to date, either on the website or even when you talk to an agent, because they say, well, the doctor is in a network, then later on you find out the doctor was terminated 2 months ago, whatever the situation may be. If that is the case, the doctor is still supposed to provide continuing care for 90 days until that patient can find another doctor. That means the insurance company and the doctor have an agreement for 90 days to provide services and exchange fees. Now let's talk about this arbitration group which was introduced, which I talked to you about here. The patient was removed from the equation. Now we have a third party, which is an arbitrator, who is going to be talking to these two people, and the decisions made by the arbitrator are supposed to be binding. The arbitrator is supposed to represent both parties, as I already mentioned. This payment amount cannot be compared to governmental agencies like Medicare, TRICARE, or Medicare. So they cannot compare the prices of those entities. They have to take a fair market value of what physicians with similar training and experience would charge for that particular procedure in that particular community. And they had to take an average of that and use that as the basis for determining what is a fair market value. They also need to take into consideration the acuity of the situation, comorbid conditions, and whether this is a teaching institution or whether it is related to any other entity. So taking all these things into consideration, the arbitrator should take offers from both the insurance company and the doctor's side and try to come up with a compromise. And that is how it is resolved with this new Surprise Medical Billing Act. So ladies and gentlemen, there are two areas which were still left uncovered in this particular fiasco. Number one, ambulances. Ambulance charges are outrageous. You may be making a 10-minute trip from your house to a hospital on the other side of the freeway, and the bill may be like $1,000. I mean, I cannot for the life of me imagine why it would cost $1,000 to go in an ambulance for 10 minutes if you had a panic attack. Your family member could have taken, but since you dialed at 911, now the ambulance is here and you're going to have to go in an ambulance. 71% of the ambulance billings are falling into this category. Somehow the Congress got so tired of dealing with the doctors, the hospitals, and the HMOs, they just said, well, we'll do it another time. We spent too much time on this, we need to move on. Folks, I'm talking to the public. You need to get this ambulance issue resolved. Talk to your congressmen, talk to your senators, and talk to your politicians and tell them to introduce a bill so that it covers the ambulance services also. There is another factor, and I'm a doctor, so I'm going to be bashing on the doctors for a second. There are certain circumstances where every doctor in town belongs to an organization, I don't want to pick on any doctors. I would say Anesthesia of Houston. Houston's got 4 million people. I mean, you're covering like a whole third major largest city in the United States. They all gang together and say, okay, we are not going to join any HMO. We're not going to join any PPO. Everything is going to be out of network, and we're going to negotiate with the arbitrator. Can you imagine a fiasco that's going to happen? So there's got to be some rationale. There's got to be some reasoning as to how we practice medicine in a community where we live and where we serve. I mean, nothing prevents you from forming an organization and saying, okay, we don't belong to... This has happened in Houston, in northwest side of town. They started a new hospital. They said, we are not joining any HMO, any PPO. Everything is going to be out of network. And they were making good money. These are some of the things that are beyond the scope of just a simple law or a regulation. But these are all the dynamics that go into how medical practice evolves. I hope this has been educational to you. Thank you so much for watching, and please do subscribe to our YouTube channel. I will see you in the next video.